We are Save the Tatas Incorporated, and our mission is to fight breast cancer one SNP chip at a time.
Women in the U.S. have a 1 out of 8, or about 12.5% chance of developing breast cancer at some point in their lifetime. 5 to 10% of all breast cancer cases are linked to genetic causes. There is a 0.9% mortality rate due to breast cancer alone among women aged 60 to 69. Men are at risk for breast cancer too, though their chances are only about 0.9%.
BRCA1 and BRCA2 are genes that suppress the tumor. Moreover, the variations in the BRCA1 and BRCA2 gene are linked to breast cancer and ovarian cancer. According to the breast cancer page for Snipopedia, there are currently 2,653 BRCA1 variants, and about 500 of them are causal variants. Also, there are 3,140 BRCA2 variants, and a couple hundred of them are causal as well. While having causal variants does not guarantee that someone with a causal variant has cancer or will get cancer, it can mean that they can have an increased risk of developing cancer in their lifetime. The BRCA1 and BRCA2 genes are the most common causes of genetically linked breast cancer. This is most likely because both genes code for proteins that repair DNA. If the genes are mutated, DNA will no longer be repaired, causing an increase in unhealthy cells.
Breast cancer can be linked to about 20 different genes, more or less, which each have genetic variations that can increase risk of breast cancer development. Our genetic test will examine both BRCA1 and BRCA2 genetic variations and will test for the 13 combined SNPs that these genes have. We chose to examine RS4193463 on the BRCA1 gene in detail because many of its alleles are linked to a pathogenic risk for developing breast cancer. The variants that are linked to a higher risk of developing breast cancer are AT, GG, and GT. The healthy variation for this gene is TT. A study conducted to determine the risk of developing breast cancer in patients with BRCA1 variations found that mutations in the BRCA1 gene accounts for 45% of families with a high incidence of breast cancer and 80 to 90% of families with breast and ovarian cancer. The RS4129343 SNP is among those listed as a common mutation in patients with breast cancer. From this, we can infer that the mutations in the BRCA1 gene are so prevalent in patients with breast cancer that there must be a significantly increased risk to have certain genotypes of the SNP.
Patients should consider having this test done as it can warn them of any irregularities in the BRCA1 and BRCA2 genes that could potentially lead to the development of breast or ovarian cancer. This test can accurately predict how much of a risk the patient has for developing breast cancer. If patients find that they have a higher risk, they can receive treatment before it is too late. For example, an increased magnitude of 6 is linked to the SNP that we are focused on, RS4129343, which is a relatively high risk magnitude for breast cancer development.
When performing a SNP chip test, you have to already know which variants you're looking for. This causes the test to be somewhat narrow because even though you can test up to 1 million SNPs at once, the entire human genome has over 11.5 million SNPs. Also, a SNP chip test can only do so much. The test itself cannot determine the progression of a disorder, along with the symptoms. Moreover, once diagnosed with a genetic disorder, there are little to no treatments that will completely cure the disorder. However, there are ways to help patients cope with it and prepare for it.
Patients and families who are getting these genetic tests done most likely have been personally affected by breast cancer in the past and most likely have a significant risk of developing the disease in the future, so it is important for us to be sensitive to them. It is important for patients to know that they are not only going to be treated with honesty, compassion, and empathy, but also that they can trust that their genetic information will remain confidential and not have an impact on their insurance policies or employment prospects. It is important to promote an environment of support and reassurance for prospective patients, as they will need to be in a calm emotional state to discuss their results.